Quickly, what do you want the country to know right now, tonight?
I think what I'd like the country to know is that we're stretched to breaking point, that we need help, and we need help more than anything else with retaining nursing staff. There's a national nursing shortage, but it is especially a problem down here.
Dr. Barbara, thank you very much for your insights tonight. We appreciate it.
What is COVID doing to your community?
It's killing us. It's killing our residents. It's killing our demographics. It's killing the staff emotionally. It's a complete overwhelming situation.
I had a patient tell me one day that he said, I know I'm going to die. I literally walked out of the room and just put my back to the wall and cried. Because what else do you do? I mean, and then I had to go wipe my eyes and clear them and go into my next person's room.
As ICU beds fill up, the emergency room is having to help care for COVID-19 patients.
I don't know where people get this DNA, but the level of altruism that these people have, it's unbelievable. And they do it for the team, for each other. They are the most selfless people that exist. Otherwise, they wouldn't be here working like they are. They are absolutely amazing. The problem is right now in the world, they're sort of like the forgotten soldiers, you know, so they've got to depend on each other. Everybody who works here has got to depend on each other because there's a feeling that the world doesn't care right now.
And I know I can only speak for myself and you know, the people that I am close with that are in this position with me. To call us heroes, but not do what you can to protect yourself and to protect us, it's just words, and words don't save lives. Actions save lives. There is a whole generation of children right now that will grow up, hundreds of thousands of kids in the United States of America that will grow up without grandparents because of the first wave. And now we're seeing parents. There are going to be children in my own community that are orphans. And it could have been prevented.
Nicole Atherton, thank you. Thank you for what you do on a daily basis. Thank you for speaking out this morning. I wish I could reach out and hug you, quite honestly, but thank you.
While it helps, one nurse choosing to stay isn't enough.
You got everything you need?
Mississippi has at least 2,000 fewer nurses than it did at the beginning of the year.
It looks heroic and it looks, but that's not what it is. It's sweaty and hard and chaotic and bloody.
I didn't even know really what burnout meant as a nurse until I hit COVID.
Melissa Davis has worked in the ICU for 17 years. It's never been this bad.
I've seen a turnover in nurses I never would have thought would have turned over because I can't take it no more.
Do you feel that you're close to a breaking point?
I think we already broke.
Burnout, stress, grueling hours. There are multiple reasons career nurses are choosing to leave.
We've been seeing it probably hit a peak recently. We have over 120 nursing vacancies open right now.
When they do, that experience is also lost.
It takes years of training to get to the point where you can actually take care of a COVID patient. This is nothing like we've seen before.
The head of Singing River Hospital System is now urging the state to use some of its $1.8 billion in COVID relief funding for retention bonuses.
We need to give them an incentive to want to stay and continue to be a nurse.
It's hard to see a 34-year-old, the family, not make it. You can't describe that.
To have friends, colleagues who understand that, it's the only way we're all getting through this, is because we have each other.
What a story. That was our own Erica Hill reporting. And earlier this week, Governor Tate Reeves announced 1,000 healthcare personnel would be coming to Mississippi to help fill that gap. Singing River Health Systems confirmed the state has committed 59 nurses, both ICU and med-surg nurses, and 18 respiratory therapists to its 3 hospitals. They are on 60-day contracts.
As far as resources are concerned, we are stretched very thin in terms of ventilators. We're also, I think our biggest need right now is nursing staff. We are very short of nursing staff.
Doing what we need to do. We're tired. Nurses are so tired. It's getting to the point where we need help. We've been helping as much as we can, and we need help from, our community. We won't be able to say that we did everything to protect our children. I know people that would take a bullet for their kid, or that it can be as easy as taking a shot. So, as a nurse, it does wear on you to feel like it's not coming to an end anytime soon.
I'm 32, and just seeing as many 30-year-olds that there are, it's so scary. And it's not just the very sick, the ones that have multiple comorbidities. You can have 1 or 2 comorbidities, not get the vaccine, and we're seeing those patients now.
Pascagoula's Singing River Hospital can't expand COVID capacity fast enough. It's cleared beds to serve more COVID patients, but doesn't have the staff to open it. The beds sit empty.
It's exhausting, both mentally and emotionally.
Like a couple of hours, though, before we can take her.
The state of Mississippi is reporting some 3,500 new COVID cases a day, its biggest surge since the start of the pandemic. Only 36% of residents are fully vaccinated, and it's the unvaccinated now filling hospitals.
Is it frustrating? Period. Yes, but towards the individual personal patient, no, because we're to look at them as they're coming in, they have a problem, we have to fix it. We're going to take care of you, no matter what.
It's a lot, but we'll just keep pushing through. We don't have a choice. It's what we do. We're on the front lines for all of it and continue to be so.
I can't abandon this. I can't. I mean, I've wanted to, but I haven't. It all adds up when you don't have beds to put them in. So, and then it even more adds up when you don't have the staff. So acuity at this point is priority. Like whoever comes in the sickest is going to be seen.
The shortage of nurses is beginning to take a toll, as nurses are sometimes working 16-hour shifts.
We have a lot of people leaving because they see better opportunities other places, and we need people. This is a good hospital. This is a place I want to stay.
The Mississippi Emergency Management Agency says additional nurses are on the way, but Singing River Health System CEO Lee Bond says funds from the American Rescue Plan could provide a long-term solution.
We've got $1.8 billion coming into the state. If we could just allocate 25% of those federal funds, that's enough for $20 grand for every nurse in the entire state of Mississippi to do a 2-year contract to stay. That's a long-term solution.